This is actually an example of a Stryker power stretcher. You can see towards the foot there's a battery pack underneath where that gentleman's left hand is. On the right hand side, there's actually two buttons for lifting up the stretcher and putting the stretcher back down. This is another type of power stretcher. This is a Furno power stretcher. These are actually a self-loading power stretcher. You can roll it up to the back of your truck and then press a couple buttons and then just push it right in and it'll load by itself. It's really, really nice. And then here's your bariatric stretcher. You notice that it's a very special type of stretcher. It's very wide and it has specialized handles for moving the patient up and down. You'll also notice that there's special attachments, so rather than having to lift the patient up, you can push the patient along these tracks and load them into the back of the ambulance. If you look on page 57 in your textbook, there's a picture of one of these, a stair chair. It's on the bottom right-hand side. It's a Stryker and it's yellow. There are different types of stair chairs. This one here has treads on the back that allow you to move up and down, or really down, the stairs. There are also hydraulic and battery-powered stair chairs that are in existence. Some services have old aluminum-type stair chairs that are very light. These very light aluminum-framed stair chairs are very good for going upstairs because the tread on the heavier Stryker models don't allow the stretchers, or the stair chairs rather, to go up the stairs. You have to actually physically carry them if you're going upstairs, and they're heavier. So those light aluminum frame stretchers are better for private services who are constantly bringing people in and out of houses. You also have a spine board, which is a patient carrying device, as well as a spinal immobilization device. You have a short spine board that is primarily for removing patients from vehicles. It only protects the spine from the coccyx up through the neck. It doesn't immobilize the legs or anything like that. It's primarily an extrication tool. And you also have the long spine board. You have a picture of that in your textbook. The long spine board is a very rigid board. It's meant to hold the entire body and splint the entire body in place. If you have a patient who has lots of injuries, you can just go ahead and throw them on a spine board and consider those injuries splinted because it immobilizes the entire body. This is a stair chair. You can see that there's handles on the bottom and the top that collapse in and out for easier moving. There's also straps that are put in place there. Now remember, you can't put a patient who is unconscious or has altered mental status in one of these things. They have to be able to support themselves, otherwise they'll hang out and you'll have airway issues. This is a short board. There are different types. They have what we call a KED, or a Kendrick extrication device, that's more flexible than this. This is, however, a hard short board. The small piece at the top is where you would apply the neck cervical collar and secure the neck to that. The rest of it would hold the torso in place. You can also use this on your smaller patients as a pediatric spine board. And then these are your examples of your long spine boards. There's a video on Canvas on how to use those. These are other types of stretchers that are in use. Portable stretchers, they don't have wheels. They're meant to be carried. They're very light and very accessible. These are typically used in emergency type situations. Military uses a lot of these. You have a scoop stretcher, which actually breaks apart. If you have a patient who's laying on the ground, you can actually take and break the stretcher apart and then put it underneath the patient and snap them back together and lift the patient up from the floor without having to move them at all. You have a basket stretcher, or a Stokes basket, as some people will call it. These are typically used for high-angle rescue and firefighting, also used for extrication of people from boats and things like that. These are used by Coast Guard a lot. Flexible stretchers, also called a Reeves-type stretcher. These stretchers are really good for getting people out of houses. They have wooden slats in them that are rigid, that will help maintain the shape of the flexible stretcher. These are primarily used for extricating bariatric patients. And you also have a vacuum mattress. These vacuum mattresses are often used as immobilization devices. Here you have a Kendrick extrication device, or as your book calls it, a vest-type extrication device. There's actually going to be a skill station that you'll be tested on the application of this. We're going to put a video up for you guys so you guys can see how to apply that. Here's your scoop stretcher. You can see at the top and the bottom you have the collapsible, or the breakaway hinges, and then you have your straps to secure your patient in place. A lot of services are starting to use these now instead of the spine board for spinal immobilization. That's more popular in Europe, but it's catching on over here, but it isn't the standard of care yet. We're still using the spine board for spinal immobilization. Here's your basket type stretcher. Remember, this is again for high angle rescue. Coast Guard uses this a lot too. And you have your 4 straps there, and you can secure the patient in that. Oftentimes you'll see this used in helicopter rescues. Here you are with your flexible stretcher. Remember that these claps, and they're just primarily used in emergency incidents for moving patients around. You'll also see these a lot of times on athletic fields. I see these in South America and Europe on the soccer fields. They bend in the middle, but can lock in place when you're ready to use it. Here's your vacuum mattress. Vacuum mattresses are very expensive. They tend not to hold up well over time. They tend to break down very easily, but they are good for a full body immobilization. They tend to have more comfort for your patient. Basically what you do is you put the patient on the vacuum mattress, and then you would vacuum out all the air, and it would form fit to the patient. So with patients who have a suspected spinal injury, the first thing we want to do is put them onto the carrying device securely. So before we do any of that, we're going to immobilize the head, neck, and spine before we move the patient. We're going to put our hands on either side of the patient's head, and we're going to keep their head in a nice, neutral, in line with their spinal cord position. We're going to place a rigid cervical collar around their neck. Now, the rigid cervical collar doesn't actually immobilize the neck, but it reminds the patient simply to not move their head. And then we're going to maintain manual stabilization until the patient is on the spine board and fully immobilized. After they become fully immobilized, then we can remove our hands from there, but only after they're fully immobilized. That includes patients with no suspected spinal injury. We can use an extremity lift or an extremity carry. We can use this carry to move the patient to a stretcher or a stair chair. This is great if the patient's on the ground. It requires 2 people, however. This is an example of that. You have the first person in the front who's going to take either hand and wrap it underneath the knee of each of the patient, and then you're going to have the person in the back who's going to be lifting the patient from the rear. Notice that the patient or the person who is lifting from the back has their arms underneath the armpits, and they're using their hands to hold on to the patient's wrist. This gives you a firmer grip on the patient. It also prevents the patient from reaching out and grabbing things, which may knock you off balance as you're transporting that patient to the extrication device, be it a stair chair or a stretcher. You can also use what's called a direct ground lift. The direct ground lift, though, is kind of dangerous. It requires you to get down on the ground, and you may not have good body mechanics in this position, and you may wind up injuring your back. So be careful with it. Here you can see the pitfalls. Both of these women have their backs arched rather than being completely straight and flat like we want it to be. This would be a good time that we might want to utilize a scoop stretcher rather than having just to pick up the patient like this from the floor and put them into the stretcher. It's going to put a lot less strain on our back by doing it that way. It also could be a position where we kind of log roll the patient and put them onto a reeve stretcher or something like that. The benefit of the reeve stretcher in this situation is once we get to the hospital, the reeve stretcher, the flexible stretcher, has handles which we can pull with, and it provides us a lot of leverage to get them from the bed onto the to the hospital bed. Here you see them on the headman's count, 1, 2, 3. They're going to lift up and put the patient on their knees, and then they're just going to kind of dog walk over to the stretcher to put the patient on. They're just putting the patient on the stretcher in this photo. The draw sheet method is the most common method that you guys are going to be using in the field to move the patient from your stretcher to the hospital bed. Basically what you're going to do is you're going to take the sheet, you're going to pull it out from underneath the mattress and roll it up into a long cylindrical thing for you to grab, and then you're just going to pull 1, 2, 3, pull the patient over into the bed. Here they're doing a transfer from the hospital somewhere else, so they're going to use the draw sheet. You can see that they've taken the ends and they've loosened them from underneath the mattress, and they've rolled them up into tubes of fabric, and they're going to grab onto those little tubes of fabric, and they're just going to 1, 2, 3, and they're going to pull that patient over onto the stretcher. This recovery position is fantastic for patients who have an altered mental status. The reason we want to put them in this recovery position is because if they throw up or they have secretions in their airway, rather than going into the back of the airway and into the trachea where the fluid can get down into the lungs and cause damage or infection, it'll actually just drain out of the side of their mouth rather than causing them to choke or to have breathing problems. We call this also lateral recumbent. Positioning for shock. Shock is anytime we have a patient who's very, very sick and they have some kind of cardiac or respiratory compromise that prevents their body from functioning normally. When we position a patient for shock, it's usually because their blood pressure is very low, or they have some kind of respiratory disease that's or event that's causing them to not be able to breathe effectively, and they're not getting enough oxygen to their body. Anytime we have a patient who's in shock, we're just going to lay them flat. We're not going to raise their head. We're not going to lower their legs or raise their legs or anything like that or lower their head. We're just going to lay them in a nice, what we call supine or flat position. Basically, when we transfer the patient to a hospital bed, we're going to use the draw sheet method. Your book calls it a modified draw sheet method, but really it's just a draw sheet method, and we just have more people that are in. Here you have the team that's from the ER. You see the EMTs are communicating. They're talking about how they're about to move that patient. You can see the nurse is leaning over and trying to comfort the patient as they're about to move and explaining everything that's going on. Anytime we move a patient, we want to make sure that we explain to the patient exactly what we're doing so as not to cause them discomfort or anxiety. Okay, everybody's making eye contact in this photo. They're communicating non-verbally as well as verbally. They're about to move the patient onto the stretcher. Whoever's the leader, usually the person who's pulling and towards the head, is going to do a count. They're going to go 1, 2, 3, and they're going to pull at the same time. The EMTs who are on the other side aren't going to pull. They're not going to push. All they're going to do is lift up. They're going to lift up to reduce the amount of friction and allow the patient to be more easily transferred over. With 4 guys like this, it's going to be a very smooth transfer. They moved them right over exactly as they would. And at this point, as they're moving them over, they're lifting and they're supporting the patient so the patient doesn't fall or hit their butt on the rail or anything like that. Once the patient is in place, they're going to put the rails up on the bed and have the patient secured. This is a video if you want to watch on Canvas. This is basically the same video, how to do a log roll and put a patient on a spine board. So just to review, just make sure that you're using good body mechanics. You're doing what's safe for you. Then after you use body mechanics and ensure your own safety with the lift, ensure the patient's safety, use the correct tools, use good communication, call for backup, call for assistance if you need it. Don't ever move a patient who might have a spinal injury if they're completely stable without taking spinal precautions. If you have a patient who may be deteriorating or might have a life threat but is in not immediate danger from their surrounding environment, you're going to go ahead and do what we call an urgent move. Okay? In an emergency move, you have a patient who has a severe life-threatening condition that needs to be immediately treated, or they may also be in a life-threatening environment where there's fire, the building may collapse, or they could just be in the way of you trying to treat another patient who is critically ill. That's an emergency move. Okay? Remember the different types of body mechanics that we have, or not body mechanics, but the different types of devices that we have: stair chairs, stretchers, Reeve stretchers. Remember the different types of lifts that are available to us. Make sure that you're familiar with these tools and how to utilize them. Okay. The next chapter we talk about is actually going to be chapter 1. We're going to start next week with that. When we come to class, we're going to start working on all of these lifts. We're going to use some of this equipment, and I'm going to demonstrate how to use it in the lab. We'll do some critical thinking skills, and we'll do some assignments in class. I'll see you guys on Thursday, and you have a good week.